Fatty liver disease needs a policy of global management of several clinical conditions that affect such individuals, including diabetes mellitus, dyslipidemia, osteoarthritis, cardiovascular disease, and cancers. Thus, management is based on a team approach, including primary care physicians, hepatologists, dietitians, endocrinologists, and orthopedics. However, fatty liver disease needs two approaches, namely weight reduction across a spectrum of disease and pharmacotherapy to arrest and reverse fibrosis in patients with NASH and cirrhosis. For weight reduction, a tiered approach has to be instituted, namely lifestyle modifications, anti-obesity drugs, and bariatric surgery. Pharmacotherapy, in its strict sense, is limited to a single recently FDA-approved drug, resmetirom. Lifestyle modifications are the cornerstone for managing fatty liver disease across the spectrum. Goals include controlling metabolic risk factors, metabolic syndrome, diabetes, hypertension, and dyslipidemia, weight reduction in obese and overweight people, modifications without weight reduction in lean people, and addressing other factors like coffee, sleep, shift work, social jet lag, and alcohol. Weight loss of at least 3 to 5% of body weight appears necessary to improve steatosis. However, a greater weight loss, 7 to 10%, is needed to improve NASH, including fibrosis. A combination of very low caloric diet of 500 to 1000 kilocalories and moderate intensity aerobic or resistant exercises of 30 to 45 minutes per day, 5 days per week is the rule. Other dietetic advice that may be needed includes limiting your intake of fats which are high in calories and increase your chance of developing obesity. Replacing saturated fats and trans fats with unsaturated fats, especially omega-3 fatty acids, may reduce your chance of heart disease if you have NAFLD. Eating more low glycemic index foods like fruits, vegetables, and whole grain is advisable. These foods affect your blood glucose less than the high glycemic index foods such as white bread, white rice, and potato. One must avoid food and drinks that contain large amount of simple sugars, especially fructose. Fructose is found in soft drinks, support drinks, sweetened tea, and juices. Table sugar, called sucrose, is rapidly changed to glucose and fructose during the digestion and is therefore a major source of fructose. Recently, intermittent fasting like the one in Ramadan has been shown to promote weight loss in people with type 2 diabetes. However, well said than done. Most patients fail to reduce weight or gain weight after an initial success. Patients who fail to reduce weight or gain weight after initial loss must be evaluated for anti-obesity drugs or bariatric surgery procedures based on specific indications. We have a long list of anti-obesity drugs, all FDA approved, that seem to be doing well in clinical practice. However, the drugs under GLP-1 agonist class and the recently introduced dual agonists have taken Western market by storm. Of several drugs under this class, semaglutide and the dual agonist tirzepatide can induce 12 to 17% weight loss in around 60% patients, a remarkable phenomenon. Both are available as weekly injectables in the West. We are lucky to have an oral preparation of semaglutide as Ribylsis. However, weight reduction with the anti-obesity drugs has not yet been shown to benefit fibrosis improvement. Bariatric surgery, either endoscopic or surgical, is the most reliable method for achieving substantial, sustained weight loss among treatment recommended for weight loss. These procedures are safe when performed by skilled surgeons, and the benefit includes reduced weight, improved quality of life, decreased obesity-related comorbidities, and increased life expectancy. The current evidence suggests that bariatric surgery for patients with severe obesity decreases the grades of steatosis, hepatic inflammation, and fibrosis. Ladies and gentlemen, the most frustrating issue in managing fatty liver disease is the status of pharmacotherapy, meant to arrest or reverse liver fibrosis. Here and everywhere, we have 3 drugs: vitamin E, pioglitazone, and sorglitazone. In well-controlled clinical trials, all these drugs are effective in reducing NASH. However, none of these have been shown effective in reducing liver fibrosis, a critical factor in long-term survival of patients. Consequently, none of these drugs are FDA approved. Resmetirom is an oral, liver-directed thyroid hormone receptor beta-selective agonist in the development for treatment of NASH with liver fibrosis. Resmetirom works to reduce liver fat by stimulating fatty acid degradation and oxidation. In a 52-week phase 3 MASTER-NASH trial published in NAGM on February 7, 2024, NASH resolution with no worsening of fibrosis was achieved in 25.9% of patients with 80 milligrams of resmetirom group and 29.9% of those in the 100 milligram resmetirom group as compared to 9.7% of those in the placebo group. Fibrosis improvement by at least one stage with no worsening of the NAFLD activity score was achieved in 24.2% of patients with 80 milligram of resmetirom group and 25.9% of those in 100 milligram group as compared to 14.2% of those in the placebo group. Based on these results, resmetirom had FDA approval on March 14, 2024 to treat patients with MASH and moderate to advanced liver fibrosis. The recommended dose is 80 milligram orally once daily for patients weighing less than 100 kilograms and 100 milligram daily for those weighing more than 100 kilograms. Resmetirom is metabolized partly by liver, predominantly by cytochrome 450, and strong cytochrome 450 inhibitors should be avoided. With such a disturbing scenario and a ray of hope, what is in the future? Several phase 3 and phase 2 trials are going on to target the pathogenetic pathway to arrest, reverse, and treat this progressive liver disease, which has emerged as a pandemic and will continue to do so. Ladies and gentlemen, and members of the formal medical faculty from Kashmir, I have presented this oration on fatty liver disease, an emerging pandemic, in the loving memory of highly respected and accomplished human, Dr. Farooq Ashai. Here I announce, let it be so. I appreciate your patience. God bless you and your near and dear ones. I urge all of you to take care about your jigar, which is so dear to all of you. Thank you.